Good day, everyone. We are the Group 1B from BSN 3B. I am Katrina Chua, along with my members Brian Bermejo, Patricia Borromeo, Stephanie Bulacan, Cesar Rose Chavez, and Joshua Adrian Tunlo. We will discuss what our healthcare workers are going through during these trying times with our research entitled Gleam of Hope, Lived Experiences of Healthcare Workers During the COVID-19 Pandemic. To start us off, we have Brian Bermejo with our background of the study.
For the background of the study, the development and length of the COVID-19 pandemic has been a gigantic challenge for health systems, medical health workers, and world leaders as far as their abilities that they can provide and also their shortcomings. COVID-19 is a disease caused by the severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, a virus with a zoonotic nature. An urgent impact of this pandemic has been taking a toll on the well-being of our healthcare workers. The main goal of the study was to attempt an in-depth investigation and study of the lived experiences of medical health care workers that are stationed in Bacolod City that were frontline during this COVID-19 pandemic. Statement of the problem. This study aims to explore the lived experiences of the healthcare workers during the COVID-19 pandemic in Bacolod City.
This is our schematic diagram for a theoretical and conceptual framework. The study can be based on Sister Callisto Roy's adaptation model, as she views a person as a biopsychosocial being in constant association with their environment. And this environment can be a source of stimuli, and this stimuli can be classified into focal, the immediate stimulus that changes the person's adaptation. For example, in this context, the COVID-19 pandemic, contextual, that contributes to the effects of the focal stimuli, that can be the lack of manpower, the lack of PPEs, and the rise in cases. And for the residual stimuli, the supplementary factors that can be the sense of loneliness and isolation our healthcare workers may feel.
For the significance of the study, this study may be beneficial to the following hospital institutions, so that they may plan better methods to maintain optimal well-being of their employees. Hospital administrators, so it can render hospital staff the necessary supplications. Healthcare workers assigned to different departments to highlight the needs and prerequisites of healthcare workers in their field. The public, so that they may learn how to cooperate with the medical team to ensure their safety. The academe, so that they may improve method for teaching students to combat challenges during the pandemic. The nursing students, so that they may gain insight into the bare minimum requirements to thrive and maintain wellness. Future researchers, so there may be development and improvement on the study.
Research designs. The researchers utilized qualitative phenomenological research design. Participants of the study. The participants of the study included 5 healthcare workers from different fields with a minimum of 1 year of experience have served during the height of the pandemic. These healthcare workers were chosen by the researchers through purposive snowball sampling technique.
For the research instrument, the researchers have utilized a researcher-made semi-structured interview schedule as a form of research instrument for the study, and they will be correlated through respondents. The interview guide consists of 2 parts. The first part is designed to collect the demographic data of the respondent, and the second part is the semi-structured interview guide on their experiences of COVID-19 pandemic in Bacolod City. Specifically, the question, what are the lived experiences of healthcare workers during the pandemic? For the data gathering procedure, first, contacting the participants. Participants are chosen through personal contact of the researchers. In a way, rapport is somewhat established due to having a personal contact of the participant. An appointment for the formal in-depth interview will then be set. Next, for the informed consent, prior to interview, the participant will be given an informed consent, which entails the purpose of the research to ensure confidentiality and trustworthiness. For the meeting place, due to strict health safety protocols, both parties will most likely meet through online conference applications such as Zoom, Google Meet, or other conference applications the participant prefers. For the recording of the interview, a recording of the interview is utilized to record the data and capture the verbatim answers of the participant.
For the data analysis, the Colyses model is utilized for the data analysis. The data was collected from in-depth interviews, transcribed, and verified by the researchers to correct casual errors. The significant statements and ideas were extracted and categorized into themes. For the ethical considerations, the researchers ensured that the interactions with their participants were done with respect to their privacy and confidentiality. Appropriate approaches to informed consent, privacy, and data storage were observed.
For our results and discussion, we have Mr. Brian Bermejo with our demographic data.
For the demographic data of the participants, we have a total of 5 female participants, all with medical backgrounds and are professionals that have been frontline during this pandemic.
Theme 1, Fear, the Natural Response. Fear has been identified as one of the notable concerns of the healthcare workers. Participants claimed that the nature of the disease, in relation to the fact that vaccine and treatment for COVID-19 at the time of the interview was still undetermined, along with the lack of personal protective equipment, exposure to a high-risk environment and contraction of the virus are among the identified precipitators of the participants' fear. For the significant statements, the fear of encountering different people, giving medicines, and talking to patients. Sa hospital, nagiting kita permi sa medicine o kung cure, pero that time wala pa sang vaccine na ihatag sa imo kung malatnan ka sang ina nga disease. Trauma gid ko ya, kay daw wala ko ya sense nga naprotect ko ang self ko against COVID.
Theme 2, Discrimination over Appreciation. Discrimination has been identified as one of the factors of healthcare workers during the COVID-19 pandemic. The participants claimed that they were discriminated by individuals that they encountered due to the belief of the people in the social stigma. Such stigma entails that if you're a healthcare worker, you have acquired or is a major contributing factor for virus transmission. Some of the significant statements includes, ginpalayas ko sa dorm ko kay amo na may positive as hospital na lang ko gastay. May time kis nga dira lang sa gwa nimo makagwa ka man dira lang sa gate nyo. May time man kis nga matulok si mo ang neighbor mo, masulod ka naman, so may aragit mga discrimination nga experience.
Theme 3, Unpreparedness, an improvisational turn of events. One of the main issues identified in the interview centers around unpreparedness. Due to this unforeseen circumstance, appropriate preparation and response plan were not settled. This lack of preparation led to inadequate supply and use of medical resources such as personal protective equipment or PPEs, and insufficient management of the hospital with regards to infection control. So for the significant statements, like before, daw katawag sa Mundo Suicide Squad since before ga-face kami sang suspect COVID case. So ang PPEs are not proper kaya like gowns lang gina-provide sa amon. Face mask, hindi pa to N95 before. Kagang treatment mismo sa hospital since hindi pa kabalo mag-manage mismo ang hospital. Nobody was ready and nobody anticipated that a very extreme situation such as this pandemic would happen. I was taken aback, even if I am a healthcare professional, even if I was genetically probably created to be a doctor of medicine. Of course, I did not expect this extreme scenario to happen.
Theme 4, Hope, the light at the end of the tunnel. Healthcare workers, despite their apprehensions and fear of acquiring the virus, have remained hopeful and self-comfort in placing their hope to God that tomorrow may be better. They continue to live up to the profession that they have sworn upon and to be of service towards a better state of healthcare to the people. And for the significant statements, as long mag-cooperate lang ang tanan, daw makaya man bala malikawan ng at para man maprotect naman ang self ta, kag to others, paano ito mapalayo mismo sa virus itself. The next statement is, during the time, ang akon yung coping mechanism is my faith sa aton ni Ginoo, kag akon gimutang sa akon pamisaron, these are all the mga ginahimo sang kaaway sa aton, ng mga ginahimo ni Satan.
For the conclusion, the experiences of these healthcare workers vary based on their nature of occupation, institutional affiliation, and their attitude towards their work, as they have had different personal experiences, such as being infected with the virus and in return infecting their family members. Commonly, they have experienced fear, discrimination, unpreparedness, and hope, as they fear for their lives with the additional discrimination due to the social stigma they have received from the people. These healthcare workers face more challenges as they encounter unpreparedness such as the lack of PPEs and emergency response. Despite all of this, these participants still have hope within themselves and towards their patients.
So for the recommendations, the hospital institution may formulate contingency plan as an emergency response action in preparation for future health-related crises. Essential needs of the healthcare workers such as PPEs and medical equipment. The public may impede the stigma against healthcare workers, deliver coherent information towards COVID-19 as they need to be educated, and follow implemented public health guidelines for their own well-being. For the USLS College of Nursing, they may continue to provide a holistic education that will produce quality Lasallian nurses. For the nursing students, that they may acknowledge the stimuli that our healthcare workers encounter in times of crisis and how they conform and adapt to this. For the future researchers, they may able to conduct further studies on the lived experience of healthcare workers during the COVID-19 pandemic.
These are our references.
We would like to acknowledge the University of St. LaSalle, Dr. Cajera, Dr. Gosling Fiao, Dr. Dolendo, our Dean, Mrs. Edemni, and most especially to God for making all these possible. Thank you.